Hello, everyone, and welcome to our session today. My name is Michelle Lanter-Smith with ePay Systems. Today we're going to be talking about how to lower healthcare costs in the face of healthcare reform uncertainty. And I bet all of you on the phone today would certainly agree with that title. Let's talk a little bit about what we're going to cover today. I am so excited to have all of you with us. We have a great speaker with us that has been in this industry for years and can really give you some good advice of how to move forward and really shave some costs. So I'm going to do some introductions, and then we're going to talk about our main topic today, which is fully insured or self-funded. What is this self-funded? And we're really going to get into the nuts and bolts and what it's all about. We're going to look at when you go to self-funding, if you think about self-funding, you know, you've got some options. You don't have to always do it with some of the more standard ways of attacking healthcare insurance. So we're going to talk about those options, and we're going to talk specifically about how some of the options can help you control your healthcare costs. So let me tell you a little bit about our speaker today, Ron Walter. Ron, welcome. Thanks for joining us.
My pleasure.
Ron has been in this industry for over 67 years. He is...
67 years.
I thought I would see if I could catch your attention. He started in the business, I believe, in 1967, quite a long time ago. He is now the Chief Executive Officer of Professional Benefits Administrator here in the Chicagoland area and serves clients all over the nation, providing them with a third-party administration services on their health care insurance. He's on many different boards. And also has been the past president of the Society of Professional Benefit Administrators. I have spent a lot of time with Ron over my years, and I have found him to be extremely helpful. We here at ePay, obviously we are a business too, and we face healthcare costs, and we have found some really good solutions working with Ron on how to save on our healthcare costs too. So what we wanted to do today is we really wanted to share that news and these ideas with you. Whether you're a current customer of ours today or you're looking to be a customer of ours someday, we really were excited about what we're seeing with some of these benefits, and we just wanted to share it with everyone and provide just a good education on it. Before we get started, let me tell all of you on the line, if you're not familiar with ePay Systems, a little bit about ePay. You know, we've been in the business since 2001, and we specialize in the human capital management space. We have solutions that go all the way from applicant tracking, so getting people onboarded into your company, tracking them in time and attendance, paying them, and then managing them with a performance management system. So it's a completely unified human capital management solution. We have more than 75,000 work sites across the nation on ePay. Now, what we really focus on, though, is we focus on people that have hourly workers, tend to have hourly workers that move around from job to job, customer to customer, have a lot of union contracts, shift differentials, crazy things like that, and it can make it very hard to track their time, pay them, and manage them. And that's why at the heart of our system, what makes us different than all the other HCM guys out there is our time and labor management technology. We also have great customer support. Everybody gets premium support. That's 24/7 every day of the year. And we all know in this HR technology space how important good customer service is. Because of our great customer service, we boast a retention rate of 99%, and we're pretty proud of that. You can see some of our clients on there, everyone from some small clients to some very large clients like the U.S. Army. So let's get into, though, our session today, because we got a very full agenda and would love to take you through it. Before we get started, I just want everybody to see the legal disclaimer that's up on your slides right now that you're looking at. Again, this is good general information. Before ever making any type of decision, though, you should consult your counsel. All right. Ron, let's talk a little bit about what's going on. I mean, you can't turn on the radio without hearing about healthcare reform, Healthcare Act, what the Senate is discussing. They just voted, was it yesterday, to keep talking about it some more. So I'd like to understand from your years and years of experience, what do you see as the problem with group health care today?
Well, thanks, Michelle. The real issue is really not health insurance as much as it is the cost of health care. Over the past 5 years, the cost of health care has gone up over 38%. And, you know, during the same period of time as employers, you and I are forced with competition and everything else, we're actually being asked, if requested or told, that we have to hold the line on our prices. So on one side, the costs are going up, and the other side, we're being told that hold our revenue down. And for most companies, the cost of their health plan is either the second or third largest line on their P&L statement.
Really? Wow.
So it's a big payroll being first, healthcare being second or third if there's inventory work on progress. And then, as you mentioned, the uncertainty of healthcare reform, or the reform of the reform, or what do we do? What did I hear last night? They're talking about a skinny reform now. And I have no idea what a skinny reform is, but it doesn't seem very fat. So
there's a pretty uncertain environment what's happening right now.
Absolutely.
And us as businesses got to figure out, what are we going to do going forward? How do we control our costs?
We're always paying attention to payroll, but we're not looking at this number 2 or number 3 expense.
Well, those of you listening to us today, we want to get you a little bit involved today. Call it Attendee Engagement, and we're going to ask you a question. So if you would, go to your computers. And the question is, how much have your health insurance costs gone up in the last year? 1 to 10%, 11 to 40%, greater than 40%, or you're really not sure? Just push a button, A, B, C, D, and let's see how our poll goes. You ready for this, Ron?
I am.
All right. It shows 60% of our attendees say they have gone up 11 to 40%.
Whoa.
Wow.
Well, like I said earlier, that the cost of health care translates into the cost of your insurance premiums.
Right. Right. Okay, let's get into it. Let's talk about the options out there. Okay? So tell me a little bit, let's start at the differences between a fully insured plan and a self-funded plan.
Well, the fully insured is pretty straightforward because the carrier takes all the risk. By the same token, they determine what the reserve levels are and the capital. They keep everything. The insurer manages and oversees all of the vendors, and you simply pay a fixed monthly cost. However, if you really understand the finances of a healthcare plan, you realize that once you have a couple hundred lives covered under your plan, there's no insurance in group insurance, because over a few, just 2 or 3 years, your premiums will always cover all your costs. So if there's really no insurance in group insurance, why not look at an option that allows you to get rid of all of those huge unnecessary costs?
So you're saying your premiums really do cover all your expense claims out there.
Right. On the self-funded side, however, the employer will accept some of the risk, and I'll explain some of the risk later. They determine what reserve levels should be there. They manage the reserves, and they keep the excess on their own books. And an employer or TPA will also manage all the vendors. In most instances, it's just the TPA managing the vendors, which gives you more control over the quality and cost of the services. So those are the big differences.
Okay, so now my understanding is within self-funded, you have some options within self-funded. Can you explain a little bit more?
Right, the carriers have their version of self-funding because they realize that it's really in the best interest of the employer to have that option. However, with the carriers, it's called an ASO arrangement, which really stands for Administration Services Only. And really what they do is they just do the perfunctory services of paying the claims and managing. And many times it's hard to get much information out of them as to what you do. Contrast that, if you will, with that being of a TPA. Now, the TPA really has 2 meanings. Of course, the generic meaning is independent or the third-party administrator. But from our perspective, the real meaning of TPA is total plan administration. We do everything. We provide all the administration, the claims costs, the edits, the improper billing, the customer service, the plan design, the options, and total transparency. So we do everything on behalf of our client. And many clients think about self-funding as they're going to have to take on all these risks and all of these administrative duties. That's not true. And in addition to that, it brings true transparency. Now, what do I mean by that? For the first time, you're going to really know what all your costs are for, what your administration costs are, what your stop-loss costs are, what your network access fees, what commissions you're paying, and how much you're saving and discounts and subrogation and all of the other things that are involved in managing a plan properly.
So it sounds like you can really control your costs. So let's dig into that. How can you lower your healthcare costs?
Well, how do we get meaningful ways to design the benefits in this highly regulated environment? And how do we put more financial control in the hands of the members? Well, self-funding may very well be the answer. In fact, Michelle, more than 2/3 of all employees covered under employer plans are in self-funded plans one way or the other, because it is the most cost-effective way to do that. And we now have the freedom to customize your health plan, address the company objectives, because the insurance carrier objectives and the company objectives may not always be the same. And we gain the potential savings for the client, and of course, finding ways to reduce the future cost of the claims, which is the biggest part of that.
Question for you. You said customize your health plan. What kind of things can you customize in a health plan to save money?
Well, with the carriers have some pretty good plan options, and in no means do I want to say that they don't have good options, but they lack a lot of flexibility. For example, if we find that a client is using ER services way too much, and ER services, they're telling us that 80% of the time when a person goes to the ER, they don't belong there because it's not necessary to them. So if we find a client's using too much ER services, and we can then put in a teledoc option. So instead of going to the ER for this 80%, call a doctor. You can usually get your script, and personally, I've had experience with that, and they've told me to take my wife to the emergency room. But all the other times, they call in a script, and a couple days later, everything is fine, and we're moving on. We may find that in order to incentivize people to do that or penalize them for not doing it, we can put in a copay for an ER visit that's a little bit higher to get their attention, because most people will respond to financial incentives.
Well, interesting. You really can get creative to keep your costs down. So let's talk about then where you were going with this in terms of how does a self-funded health plan really work?
Well, rather than funding your health plan with non-refundable premiums, a self-funded plan really treats claims just like any other expense. So the benefits are basically claims if they're at or below the anticipated level. It's an immediate savings because you haven't spent all this money in premium. You just pay the claims on an ongoing basis. Also, you avoid the reserves, the contingency margins, the insurance company profit, advertising costs. Try to watch a Hawks game or a Bulls game without seeing all those commercials on the side.
All the time. All the time you see their commercials.
And then there's premium taxes. All those unnecessary costs that I talk about later can be avoided. Now, from a regulatory standpoint, all plans, whether you're fully insured or self-funded, are controlled by the federal law called ERISA. But if you're self-funded, you can now avoid all of the different laws in the various states. And it's estimated there's like 1,800 of those. You can also avoid some of the ACA mandated coverages. And you gain transparency, which we think is really, really important. Because now for the first time, you know exactly what you're paying for in claims, administration, insurance costs, and commissions. So you really understand where your money is going. in other words, and if you think about it, the total administrative costs with your stop loss premiums, your claims typically are no greater than the claims paid or the premium paid to the insurance company. And you realize, Michelle, that contrary to what they'd like to be able to do, carriers cannot print money. The IRS doesn't allow them to print money. So in the bigger picture, your premiums are going to cover all of their costs. It has to cover all your claims. It has to cover all your administration costs. It has to cover all of the reserves. And at the end of the day, when it's all said and done, they have to have a profit. That's what your premiums give to the carrier. So why not take a lot of that and keep it on your own books? Now, I said earlier that the employer accepts some risk. They not all the risk, because no employer is going to want to accept the risk of a $300,000 or $500,000 premature baby claim or a huge cancer claim, because all of our clients, even though we consider them self-funded, have an umbrella called the stop loss or the excess coverage. And the term self-funding is really a misnomer, because even though I said earlier that there's no insurance in group insurance, there is insurance if you're self-funded, because the stop loss coverage is really umbrella coverage. And your umbrella could be, depending on the size of your group, $40,000. It's like a corporate deductible. And then over that, you get reimbursed for any large claims. So, and then on the excess side, if you have too many, I often say, if you have a swine flu epidemic that really happens, and you just have a flood of $20,000 claims, you have a cap there. So you have the umbrella to protect you against that one huge claim, or just a ton of smaller claims. In a fully insured plans, the premiums and everything are held and invested by the employer. But in a self-funded plan, you simply pay the monthly cost, the fixed cost on a monthly basis. You pay the claims weekly as they come due. And then you hold and invest the reserves. And I might add, with a self-funded plan, service issues are usually a lot easier to take care of and resolve. And to be blunt, there's usually less of them. So this frees up the HR to do other things like keeping time. Let's look into some of the details between the two. As I mentioned earlier, the maximum cost on a fully insured plan is your premium. But conversely, that's also the minimum cost. So there's no room for savings in there. So it's not you're going to pay more, you're not going to pay less. However, in a self-funded plan, you have the potential for savings. And notice on this slide, in the upper left-hand corner, I'm starting to use the real term, partial self-funding.
Okay.
Because that's what really it is. It's partially self-funding. In a self-funded plan, the total plan cost equals the sum of your administration cost, the stop-loss cost that I just talked about, and then the claim charges minus any stop-loss reimbursements. And as I mentioned before, there's always a maximum cost on the claims. In contrast to a fully insured plan, the savings will result if the claims are below the maximum or expected, and you're going to have lower fixed costs. So when you add them all together, that translates to a much more cost-effective plan. Let's take a look at a real-life example.
Yeah, I'd like to see an example how this works.
This is a group that we worked on a couple years ago. And as you can see here, there are 203 employees, and their non-refundable minimum maximum cost premium was $2,267,000. Forget the pennies for smaller numbers for a moment. And in addition to that, at renewal, the carrier was asking for an 11% increase, which kind of goes right in line with what the survey said. What the
11 to 40%, right?
That are expecting those costs. They looked at a self-funded plan, and we put together the program. And on the right-hand side there, the administration costs were $112,000. The stop-loss premiums were $464,000. The actual claims now, at the end of the year when it was all over, the actual claims were $1,198,000, which means without the increase in the premium, the savings were over $490,000.
Amazing.
that increase in premium would have added another $249,000 to the cost of the premium. So when I'm saying 490 in savings, it's really a lot greater than that, because that doesn't even take into consideration the increase in premium that we're asked for. In this case, had they been fully insured, the carrier would have kept the $112 for administration, the $464,000 in stop loss premium. They would have kept your $490,000 in profit, and they would have paid the $1,198,000 in claims. If the plan were self-funded, the employer would pay the, as I mentioned earlier, the $112,000 for administration, $464,000 in stop loss premium, and the $1,100,000 in claim, and then would have pocketed, pocketed the $490,000 in savings. And that's another way of saying would not have spent that money. It's still on your books.
Mm-hmm. Amazing. And I bet you see this over and over again.
Over and over and over again. In addition, this $490,000 really becomes your reserves. We do need a reserve, because there are going to be, for the next year, there's going to be claims that were incurred this year that you still have to pay, and that rolls right into the renewal. It just keeps ongoing, very smooth. And that money, of course, that reserve has already been established out of that savings, and with a lot of money left over. In addition, there's a lot of other benefits in self-funding, because now with the information that we have and the claims data, we can really look at why you're spending this kind of money. In this case, the $1,100,000 in claims.
Okay. Unbelievable. There is really some ways you can shave down your health care costs. Let's ask our audience another polling question, shall we?
Great.
All right. So what is troubling you regarding your current health insurance program? Is it A, cost, B, bad customer service, C, lack of plan flexibility, like Ron talked about, or D, all of the above? Let's see what's on your mind. All right. And the answers are, okay, so 45% cost, and then 36% all of the above. So just a few people, bad customer service, lack of plan flexibility, but a big, more than a third said everything.
Yeah,
and of
when
course,
you add all those together, you're over 75%, aren't you?
Yeah.
Wow.
Yeah. So, you know, really then, let's talk a little bit more about using an independent TPA, third-party administrator. Tell us a little bit more about how it drives costs down.
Well, in addition to everything that we've talked about, we now have a good handle on why you're spending this money. We can look at the chronic conditions and look at how they're receiving their ongoing care. We can put programs into place to cut the cost of the specialty drugs, which is becoming a huge issue out there. It's not unusual to see $11,000 a month in claims for one drug for a person with chronic conditions. We can look to see how many diabetics you have and put together programs that are focused on the diabetics, because a person that's a diabetic is not a diabetic. They're a diabetic and they have high blood pressure. There are a lot of other problems that are related to that. So if we can manage these chronic conditions and focus on the people that need it, because now we know who they are, to help them live a better life. They're healthier, they're at work more, and they cost less. And these are just a few of the things that we can do. Over time, a self-funded plan can help you promote the culture of wellness within your company. The law allows you to put a 30% incentive in your premiums for the people that will participate in the healthier lifestyles. Because let's face it, if they're not incurring the claims will be less and the savings go right in your pocket. And we'll be able to then focus on the specific needs of the client's individual population. And then once a plan is self-funded, once it's in place, you'll notice a little difference in the way it operates, except it operates a lot smoother. There's fewer problems. We can get the information, and there's less issues for the employer to have to deal with. Moving from an insurance carrier's ASO program, as I mentioned earlier, you can lower your fixed cost. You will gain more flexibility. You'll have greater transparency and avoid many of the state requirements and taxes and so on. So it's really a win-win no matter how you look at it.
Okay. So you've been in the business of being a third-party administrator forever. You've had your company, and I know you probably collaborate and talk to other third-party administrator colleagues across the nation. Can you tell us a little bit more about exactly what is your job as a third-party administrator?
Well, it seems a little redundant, but really everything except funding the fixed cost and the claims. We need the client to understand that they're not taking on any additional administrative responsibilities.
None at all?
Other than funding the claims, but that's if you paid your premiums and the cost of a self-funded plan are less, well, you obviously have the money to do that.
Right.
But a good third-party administrator is going to handle all of the administrative costs, the enrollment, the eligibility, the claims administration. You're going to have PPOs and PBMs, which is the PPO is obviously the preferred provider network. The PBM is the drug vendor, and we match those to the most cost-effective one for the needs of the client. And of course, the management reporting. And as I said earlier, that we manage all vendor relationships. So the client doesn't have to say, well, who's the PBM or who's the PPO. They get a plan. The employees get the same plan document they get now. It's easier to read. It's easier to understand. And the good third-party administrator will handle all of that, so the client can run their own business and the HR can do their jobs instead of my job.
So the HR department doesn't have any more responsibility in terms of talking to employees about claims or asking questions, not claims, but here's my coverage, what's my coverage. Your customer service department does that?
Exactly. We need to know from the client who they hired, who they fired, who left the company.
Right.
So who's on, who's off, and beyond that, we basically manage everything. The client will have what we call an account manager. So if an employee comes into the office and says, I called PBA, I still don't understand, and they want to get involved in it, they'll have an account manager that's like their guardian angel, if you will. That's a dedicated person to them. They know the plan, they build a relationship, and it's easy to call them up and say, can you help me get through this? And they can talk through it. And these account managers are all former claims processors. So they know exactly what's going on, and if we did something wrong, whether it was repriced by the PPO wrong, or whether it was a misunderstanding, or it was billed wrong, whatever it is, we can fix it. We don't point fingers, we just fix it and move on, and the employee becomes happy.
Because as a third-party administrator, you're really always working for the employer.
Exactly. We're not owned by somebody, we're not owned by stockholders. It's our job to be a good partner with the client and work for them. We kind of look at paying claims like we're paying claims with our own money. And so we don't want to pay claims unless it's really eligible under the plan and the person. Typically in a medical plan, we'll pay less than half of the bills that we come in, because the other half are either discounts or duplicates or not covered and so on. So we do a really good job of managing the assets because we kind of treat it like it's our own money, and we don't want to spend it. In addition, there's all of these regulatory issues that we have, because there's COBRA, there's the ERISA and the HIPAA and the ACA and all of the associated reporting requirements and that goes with it. We continue to provide all of these things for our clients. So the regulatory issues are not an issue for our client. In fact, we actually find that it's less with a TPA than it is with a carrier. So we handle it. We handle all of it. In other words, if you're self-funded, what's the benefits to the company? Increasing financial control, happier employees, healthier bottom line, and as time goes on, as we develop these programs, a healthier workforce too.
Mm-hmm.
So it's a win-win no matter how you cut it.
So folks on the line may be thinking, this is definitely something I need to take to my boss. How do you get started?
Well, it's a process not any different than you're doing with your current broker. We would review the current plan, the prior experience, if we can get it, and determine the amount of risk that the client wants. And again, it's usually based on their size. The more employees, the bigger spread of risk they have, the higher deductible they would want on their stop loss. And then if the plan is troublesome to the employer and they say, you know, this feature in the plan has always caused our employees problems or angst, we can then modify the design of the plan to fit the needs of the client or the workforce, and then go out and get quotes for the stop loss and determine what the risk is and what the upside and the downside are, and make the presentation and review the results with the client for the potential savings and administrative values in them. So we'll review it then with the client's team to show what the upside and the downside are. It's not for everybody. Mm-hmm. There are some people out there that just get so nervous over it, but very candidly, when you're looking at the potential savings, it becomes pretty clear what the best way to go is.
Well, I imagine folks out there might have some questions. So I am going to just cover a few slides, a little bit more, talk about human capital management, while our attendees maybe put some questions in. All you got to do is you go to the right side of your screen, you'll see a box and you'll see questions. Please go ahead and type any questions that you may have. All right. Well, I told you in the beginning that ePay offers an integrated human capital management solution to really help you manage your employees, better pay your employees, and track your benefit programs, right? So I just want to give you a little framework here of what we provide. Of course, today we talked a lot about healthcare, we talked about benefits, and we have at the heart of our system a good benefit administrative system that allows you to track all the plans and associated with the employees, do benefit enrollment. Now, we actually can connect directly to a third-party administrator so that if you remember Ron said, I got to know what you're paying people and who's here and who's not, who's left you. So we do all that. We talk to Ron, we talk to the third-party administrator, and we send them a file after every payroll and electronically and get them that information. That's part of our service. Now, in addition to that, though, we really help manage the whole employee life cycle, from applicant tracking, so go out and recruiting, to onboarding. Our HR module has an onboarding module that allows you to gather all the different demographic data, banking data, have employees sign handbooks, all things like that, and enroll them in their benefits, okay? We talked about benefit administration. We also have a very robust, hardy time and labor management system. It is not your plain Jane vanilla type of time and labor management. We focus on really complex labor where you've got employees that are punching in here one day and punching in somewhere else, having to work on different jobs and tracking those time to the jobs, or tracking their tasks which is associated with a particular time of the day, including scheduling and alerting and really good visibility and analytics into what's going on at your business. This helps control your labor costs too, because as Ron said, you know, number 2 or number 3 is healthcare. Usually number 1, it can be labor. 70% of your costs can be labor. So you got to control those costs too. Obviously, then you got to pay folks. We can handle the payroll and the tax management of that. And then for some of your employees, you really want to get a good ongoing appraisal performance management system so that you can improve your employees' performance. We offer this software platform along with the services to manage payroll, tax, things like the Affordable Care Act, other types of ancillary services like COBRA. And then we give you a lot of good self-service tools for your employees, and a good employee self-service tool where they can see all their information. Mobile time tracking devices, things like that. So we find a lot of times that one of the biggest benefits for folks after a good time and labor management is really getting into benefits and tracking benefits and the onboarding of employees and managing that whole process, because onboarding employees can be a nightmare. It is a lot of work. And our solution allows you to do that and to really speed it up so that your employees enter that data once when they're being onboarded about themselves, and then it flows through the rest of the system. Some of you out there may have different type of workforces. Our applicant tracking and onboarding is available in English and in Spanish. So that also helps you, increase, I guess, your efficiencies and your ability to deal with all different types of audiences. Our onboarding tool will allow you to do your I-9s, load in all your, in terms of their benefit information and choices they have, and so on. And then there's just a little sample of the dashboard that you can see in just one area of our system, the benefit management area. All right. So again, our solution is a single sign-on system, really with seamless onboarding, superior tax management. So all your employees have to do is enter when they're onboarded where they live, and your manager has put where they're going to work, and the right tax documents come up. So no more messing in terms of, gee, do I have them filling out the right tax documents, reciprocity agreements, and things like that. And again, all of this, we serve our clients with a premium 24/7 customer support. Everyone deserves out there great customer support. And unfortunately, there's a lot of folks in the industry that don't give it. ePay, just like PBA and Ron, believes strongly in customer support.
Absolutely.
So let's see, do we have any questions out there, Ron?
Well, we got one question that a lot of people may be asking, can we get a copy of the deck? And the answer to that is good. So one of the other questions here is, let's see, you had mentioned that a self-funded plan is a good option for employers 200 plus. Our company has 75 employees. Do you think self-funding could benefit a smaller employer? Yes, it is possible. It depends on the risk tolerance of the company, because you will have years that will fluctuate and you'll say, why did I do this? And years that you're going to save, because the claims in a medical plan are more like a roller coaster. You're going to have your really high years and your lower years. So the real question is, can we get good stop loss coverage to protect the financial integrity of the company? So it can, if there's good stop loss coverage available for this size company. And that's really the only other question that we had, other than, can you send me a copy of the deck? So that means either we did a good job of explaining it, or we put everybody asleep, and when lunch is over, they can go ahead and move on to other things. So hopefully this information was of value to you. Think about it and look to see how it can help you and your company.
Well, thank you so much for coming in today to ePay here in Chicago, Illinois, and thank you for joining me here in the studio.
My pleasure, absolutely.
It was great having you. When you exit today, you're going to have a very short survey. If you wouldn't mind just answering those questions, we'd be great. Just let us know if you want today's slides, and we'll be happy to send them to you. Also, if you'd like to know more about our human capital management solution, just let us know if you'd like a personal demonstration. Or if you're not quite ready for a personal demonstration, no problem. We have another webinar just like this coming up August 10th. It's at 10 o'clock. All you got to do is go to our website, epaysystems.com, and you'll see it there, and just go ahead and register yourself. So I just want to put up there information about Ron. Of course, you know about us at ePay. You found us. But this is information here about PBA, third-party administrator here in Chicago. PBA is the firm that we personally use at ePay Systems. And then also our program manager, John Christopher. He was very influential and helpful in pulling all this information together as he works with clients day in and day out in helping Ron and his folks bring these type of solutions to the table. Thank you, everyone. At ePay Systems, we would like to be your partner. Until we talk again, have a great rest of your day. Thank you.
And good night.